You're listening to Health Professional Radio. I'm your host, Neil Howard. Thank you for joining us for another segment. We're going to be speaking with Dr. Ellie Stang. She's a board-certified pediatrician and founder and CEO of ProgenyHealth. She's joining us to talk about how American women die in childbirth at a higher rate than any other developed country. Also talking about ProgenyHealth's role in trying to get the word out and prevent this. Welcome to Health Professional Radio, Dr. Ellie Stang, and thank you for taking the time.
My pleasure. Now,
of course, I did say that you're a board-certified pediatrician and the founder and CEO of ProgenyHealth. What is it that you love about what you do?
So, certainly the work that we do at ProgenyHealth is important work. And, as a company, we are a tech-enabled healthcare services company, and our focus is really on improving the health outcomes of NICU infants. And we're different from other approaches in that we've really, for the last 20 years, taken a much more whole-person approach to managing families, which is resulting in better healthcare, better health outcomes at a lower cost. Mm-hmm. And, one thing, Neil, I might mention is the founder of the company. I often get asked why I really started out on this journey. And very briefly, in 2003, when I founded the company, I saw a very broken system for managing the healthcare needs of high-risk newborns and their families. And I believed as a pediatrician there was a better way. And set out to change that. And some of the underpinnings of what we do as a company are solving for social determinants of health, which is helping really to improve health equity for these babies and their families.
When it comes to this inequity in health outcomes for premature and I believe a term medically complex newborns, yeah. Could you talk about some of the challenges that these premature? Well, first, what is the difference, or is there a difference? Is a premature baby medically complex, or is there a distinct difference?
Yeah, that's a great question. And so, premature babies, by definition, are babies that are born before 37 weeks gestation, and certainly many of those babies can be medically complex. You'll see the term used medically complex because there are full-term babies who are not premature babies that are in the NICU with other medical complexities, whether it's congenital or other issues. Mm-hmm. So really a NICU has both full and premature babies in it. Many of those cases, of course, are medically complex, which is why they need that specialized care.
What are some of the societal determinants concerning these children?
Yeah, and so, it's such a complex issue, and NICU cases, at the outset are complex. And these babies have many needs that are beyond just their medical needs, but, needs in their home environment. And so, when you look at the causes of premature birth, evidence definitely shows that racial discrimination and economic and healthcare disparities are linked. And so we certainly see that at our work, that, these babies in the NICU are at greater risk of disability, and this can lead, if not managed for the long term, into chronic illnesses into adulthood. And when you look at social determinants of health, it incorporates and encompasses things such as, geography, mm-hmm. Gender, ethnicity, social class, and things like poverty, racism, and lack of access. And all these things together can lead to disparities in healthcare. And so it's important that they're all addressed and there's a holistic view to managing these cases, because that's going to lead to the best outcome. And one of the things I might just even illustrate in a story is, in private practice, when you have a mom coming in who is struggling with food insecurity, for example, yet she has a child she needs to bring in for well child checks. Well, if the pillars of your life aren't met, parents aren't hearing you about well child checks and other important things because they're trying to balance the mm-hmm. basics of life. And those really need to be addressed first and front and center if you're going to be able to engage them in the healthcare system and bring them to better health outcomes.
Are these inequities in healthcare the cause of American women dying in childbirth at a higher rate than any other developed country? Does that translate into premature and medically complex newborns across the board?
It sure does. And when you look at maternal mortality, you see it's much more, it's much higher in communities of color, especially in the Black community. And the reasons that there's maternal mortality are very treatable. Many of them are cardiovascular issues or hypertension. The challenge is if they're not detected early in a pregnancy and managed, the outcome of that is babies many times are born too soon, low birth weight, and the mother can have complications as well. The term for hypertension in pregnancy is preeclampsia and eclampsia. But these are treatable. So if you're not engaging a mom as early as you can into the healthcare system and as early in her pregnancy as you can, you're not going to detect these issues until the mom presents at the hospital, delivers a baby too soon, and then has her own challenges to manage. And it really is about getting ahead of that. And that's what we really try and do at Progeny, is to really do everything we can. Certainly today we work with babies in the NICU, but we're now expanding our services to start involving management of the baby, of the mom as well, and moving into maternity management.
Is Progeny Health working within these communities, or are these communities still having to come to Progeny Health?
So good question. So the services that we provide, thank goodness, are telephonic and more virtual.
Okay.
And so families, as you can imagine, families that are challenged financially, many times with transportation issues, and it certainly was highlighted during the pandemic and with COVID, location became an issue. And our model, already set up to work with parents virtually and telephonically, was able to, move it into overdrive during times of need for families. And during the beginnings of COVID last year in March, our call volumes at Progeny went up exponentially because now people were locked down and still had issues with diapers and food insecurity and whatnot. And we were able to jump in and support them. So that's the beauty of, and you're seeing much more acceptance now of models like that, because when people are challenged with getting to an appointment or driving to an office, some things, and healthcare can certainly, some of it can be done virtually, and connecting people virtually where you can solve their problems without them having to drive to a location. Certainly you need face-to-face visits with their doctors and nurses, no question, but not for every single one of their needs. And so that's why I love where the healthcare industry is moving, is a wider acceptance of, what needs to be seen in person is important and should happen, but things that can be handled virtually, reduce the burden on certainly the private offices to always see everybody, but also gets people care at the time, at the time they need it, so there's no delays.
What about the role that payers play? A NICU event is quite costly.
Yeah. And it's interesting, we often get asked about how health plans should be managing these cases. And so they're complex. Our advice is certainly, and many health plans already have this, is to make it an area of focus. These are babies and families with lots of needs. And so it's not something you want a generalist doing within a health plan. You really want focused expertise. And we'd recommend a dedicated team of people with NICU experience and a NICU background supporting these cases and families. When you don't have a coordinated system for caring for them, gaps in fragmentation and certainly variations in care occur, and that's what leads to suboptimal outcomes and higher costs. So it really is important for plans to have a focus, and not only a focus, but a specialized focus on managing these cases. And that's something we certainly provide for health plans that engage in our services. Give us
a website where we can learn a lot more about Progeny Health.
So our website is www.ProgenyHealth.com.
Well, Dr. Stang, I appreciate you joining us here on Health Professional Radio. I know not a lot of time to discuss such a vast topic, but hopefully we'll get together and speak on some more specific topics within the space, okay?
Sounds great, and thank you very much. Really enjoyed the conversation this morning, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Ellie Stang, founder and CEO of Progeny Health. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.